I'm Dr. Michelle Halyard, a member of Alpha Kappa Alpha Sorority, Delta Beta Omega chapter, and our breast cancer subcommittee. I'm also a practicing radiation oncologist at Mayo Clinic, specializing in the care of patients with breast cancer. October is Breast Cancer Awareness Month, and over the next few weeks, we're going to be talking about important topics, including mammography, which we'll be discussing today, breast cancer diagnosis and treatment and what to do if you're diagnosed, breast cancer resources, and last week we talked about signs and symptoms of breast cancer, so I encourage you to check out that recording. 1 in 8 women will develop breast cancer in her lifetime, and men can also develop breast cancer too, so it's important for men to pay attention to this information as well. Today, as I mentioned, we're going to be talking about mammograms. Did you know that the majority of breast cancers are detected by mammography? Mammography is taking an X-ray of the breast that gives us pictures of the internal makeup of the breast to determine whether there might be something that's suggestive of a cancer. It is true that examining your breast are extremely important, and sometimes that will lead to having a mammogram done, but the majority of breast cancers are detected by mammography. The mammogram procedure, again, as I said, is an X-ray. And what happens is you go into the mammography facility, you stand in front of the machine. The mammography technologist actually puts your breast between 2 large plates or plexiglass plates that actually compress the breast to flatten it out to get a better picture. The whole mammography procedure takes about 15 minutes or so, depending on how many X-rays that need to be taken of your breast. And generally, we take about 3 different views, but there could be more. So many women will ask, does a mammography or a mammogram hurt? Well, there is pressure on the breast, and if your breasts are more tender, it may cause some discomfort. However, it's only about 30 seconds of pressure at a time, and it should be tolerable for the vast majority of women. And when you weigh the benefits of mammography, I think they outweigh any discomfort. Depending on what your healthcare provider says, some women choose to take a Tylenol or Advil at 30 minutes or so before they take a mammogram, and sometimes that helps with some of the discomfort. It's important that you should always know what has been the results of your mammogram. Mammogram facilities are required to send you a report. If you do not get that report, please follow up on it. Don't assume that no news is good news, because the letter may be lost in the mail or may not get to you for some other reason. So how frequently does a mammogram need to be done? You may read different recommendations depending on the body that is making the recommendations. It is always best to discuss with your healthcare provider specific recommendations in your personal situation. The American Cancer Society recommends that for women who are at average risk of breast cancer, meaning they don't have a history of breast cancer or a family history, or they don't have other high risk factors, the following recommendations apply. For women 40 to 44, the option to start screening mammogram every year exists. The data is less clear about the benefit in that age range, but particularly for Black women who do have a higher risk of triple-negative breast cancer, which can start earlier, I usually recommend that women do start age 40 to 44 having an annual mammogram. Women age 45 to 54 should get their mammograms yearly or annually. Women 55 years of age and older can continue to get their mammograms yearly, or they can switch to every other year. Now, the age at which to stop having a mammogram has come under some debate. There's an organization called the U.S. Preventative Task Force Services that suggests that women in their 70s can go without having a mammogram and only have one if something arises that's of concern, which is not what we call a screening mammogram, but that's more of a mammogram specifically targeting a concern. However, the American Cancer Society says that screening should continue for as long as a woman is in good health and expected to live at least 10 years. Again, I ask you to talk with your healthcare provider about how frequently you should have mammograms and when to stop mammogram screening. Lastly, it is vitally important that despite this pandemic we've all been in, that you not skip your mammogram. We see women that are presenting with more advanced cancers because they forego their mammogram screening if something happens, like a pandemic. This is not only true with breast cancer, but it's true with other cancers too. So the take-home message is don't delay your mammogram or other important health-related visits. All healthcare facilities, including mammogram facilities, are taking a lot of precaution to keep you safe, even during the pandemic. So take care of your health, get your mammograms, and tell others to do the same. Next week, we're going to be talking about what to do if you do develop breast cancer. So stay tuned, and thanks for tuning in.